You will run out of patience with yourself several times in your healing. You will tire of how you break and named repeatedly, how you soften and harden religiously, how you shift between self-acceptance and self-resentment. But darling, you deserve nothing but love throughout. The only one who should feel ashamed around postpartum depression is a community who failed to support the new mother. Good evening, and once again, welcome to the program Wounds of the Heart, where we are here to help you heal from that wound that was caused by something that you know nothing about. And today I have a handsome gentleman who today will lead us through the series of prenatal and postpartum depressions when it comes to womanhood. Just let me remind you that we are live on Hope TV GH Facebook and YouTube channels. Please like our page, subscribe, and share to your friends and loved ones so that at least the education we are going to have here, they will also benefit from it. And let me tell you that Alpha Art has been wonderful all the time, putting us on the flyer. I say a big shout out to Alpha Art. He's into graphics and in anything, logo designing, anything you can use. Connect Alpha Art on 0551 404 387, 0551 404 387. And you know, the fabric I'm wearing was proudly sponsored by Slick Afrik. Slick Afrik on Instagram, Slick Afrik, Facebook, any social media handle, Slick Afrik. And if you want to also connect them, it is 0557 355 852, 0557 355 852. If you have any comment or questions, and you can send it through to our WhatsApp platform, 0559 680066, 0559 680066. That's Hope TV WhatsApp platform. If you have questions, contributions, comment, any other thing, or you can leave it on our Facebook page if you are watching us. And if you also want us to sponsor, if you want to sponsor this program and help Wounds of the Heart grow and go to places, 0559 535554, 0559 535554, and we will respond to that call. Or if you also want to let us advertise your product for you, you can also call the same line, 0559 535554, and we'll do you any product you just want to project. We would have time to talk about it here for you. Before I introduce the man who today is going to give us another beautiful discussion on postpartum. You know, previously we did prenatal, and you heard a lot from him. Today, the man we're going to talk to is Dr. James Boakye-Fodjo, who had worked at the regional hospital in Sunyani for 40 years plus, at Holy Family Hospital. For 12 years, he has been a visiting obstetrician gynecologist. He also had worked with Valley View University Adventist Hospital at Techiman for 2 years as a visiting obstetrician and gynecologist. And he is currently with the SDA Hospital at Sunyani for 15 years with monthly visit to Pisgah Advanced Medical Center in Birchim. This is the man today who is going to also educate us about postpartum depression and any related issues and how best we'll be able to overcome. Doctor, once again, good evening and welcome to the program.
Thank you very much, Pastor, and welcome to our viewers.
All right, so viewers, that is Dr. Fodjo for you, and we are here to discuss postpartum, any related issues and how best motherhood can overcome such traumatic experience, because it's not easy. And last week we heard about the prenatal consequences, how our wives, our mothers, our aunties are going through before bringing out that baby to this world. Before you were brought to this world, you saw how our mothers went through hell. Let me put that word hell, because it wasn't easy. And you know, they were at a standpoint when it comes to health and death. They were at a standpoint, the crossroad. But God being so good, they were able to overcome. Today, they have given birth. What next? Oh, Doc, What is postpartum? What is postpartum?
Right.
What does it mean?
Thank you very much, Pastor. Antepartum is before delivery.
Before delivery,
Postpartum
okay.
is after delivery.
Okay. Okay.
Antepartum before delivery.
Okay.
Postpartum after delivery.
Okay.
So postpartum issues relate to things that happen after the woman has given birth safely.
The post is after
and we
the
have
woman
a
had,
whole lot
okay.
of issues. There are a whole lot of issues that do occur in the postpartum period. So
Okay.
soon after delivery, soon after the baby is out, we have to contend with the problem called PPH, postpartum hemorrhage. That is a big, big, big problem we have to deal worldwide. In fact, it is said to be the #1 cause of death during pregnancy or after delivery.
Doc, come again with that one. Doc, please, sorry. Doc, please come again with that one. Which one is #1 cause of death? Please take your time and talk to us.
Thank you very much. I'm saying that hemorrhage, bleeding.
Okay, bleeding.
After delivery. After delivery.
Okay.
Which is called postpartum hemorrhage.
Okay.
Yeah. So we have to contend with that one. The baby is out, we are happy, husband is happy, relatives are happy, nurses are happy, but suddenly out of the blue, the woman starts pouring. And she can bleed to death if you don't act fast.
Okay.
That is what we call PPH.
Okay.
Postpartum hemorrhage.
Okay.
It's a big problem worldwide.
Okay.
But luckily now we have managed to overcome this. So they do happen, but not too much.
That is
but
fine.
Postpartum hemorrhage is always there.
Okay.
Postpartum hemorrhage is always there.
Okay.
But just that we know how to manage it.
Okay.
Midwives and doctors, we know how to manage.
All right.
Then we have to contend with loss of a baby.
Doc,
this
wait.
One has gone through delivery.
Doc, please wait. Today I'm here with you.
Yes,
please.
Sir.
So before you go into the contending with the baby, let me ask this question so that you can pass it through. When is it a disorder? Sure. When do we call postpartum disorder? When is it a disorder?
Thank you very much.
Okay.
When the unexpected, when the unexpected happens after delivery, it's a disorder.
Okay.
Usually after delivery, we expect that the woman will be fine, bleeding will be minimal, she can breastfeed the baby, the woman can move around, talk with the relatives, and that is normal. But anything out of this becomes a disorder that we have to contend with. And one of them that I just mentioned was postpartum hemorrhage.
Hemorrhage, okay.
Where they bleed more than 500 ml.
Whoa.
When they bleed more than 500 ml, or any amount that will jeopardize the woman's condition. So after delivery, we expect to see bleeding.
Okay.
In small amounts, it's normal. But when it goes beyond 500 ml, it becomes an abnormality, a disorder called postpartum hemorrhage.
Okay.
Yeah. So all the things that we are going to go through, they are not supposed to happen after delivery.
Okay.
But when they happen, then we call them postpartum disorder.
Okay.
So all the #1 thing we have to contend with is the hemorrhage, the bleeding.
All right.
Which is more than 500, or an amount that can cause problems to the woman.
Okay. Then, Doc, you were talking about the contending with the child. So speak about that one so that I will be able to ask my following questions.
Exactly. So now, luckily for us, there's no bleeding. Or there's bleeding but has been managed. What about the baby? The woman expects to take the baby home so that everybody will be happy. Husband will be happy, parents will be happy, friends will be happy. And we even start planning for the outdoor ceremony, the baby naming. But unfortunately for some people, the baby doesn't survive. The baby doesn't survive. It's born, it's already dead. That is what we call the stillbirth. It is born already dead. We may go through that one and know why sometimes this.
Exactly.
Or the baby is born all right, he's not dead, but not able to breathe properly. Breathing is very bad. What we call asphyxia. So the neonatologist will have to rush this baby to the NICU, neonatal intensive care unit. The doctors will have to handle her, handle this. Unluckily for some mothers, in spite of all the attempts that are made to help this baby survive, the baby doesn't survive and dies. And it's a big blow to the mother, to the baby's father, to relatives, to friends, and even to the hospital staff. So the second point is the loss of a baby.
The loss of a baby.
After delivery, whether it's a fresh or it's a neonatal death. Then, from there, we go to what you call the puerperium, puerperal problems. Puerperium, again, is the time after delivery, soon after the baby is born, up to 6 weeks, or sometimes up to 8 weeks. The time we call the puerperium. And a whole lot of problems do arise. The first one is called puerperal pyrexia. Pyrexia means temperature above normal. In this case, it's about 38.5 on 2 or more occasions. And it doesn't speak well for the woman. There shouldn't be temperature that much. When you get this puerperal pyrexia, it means so many things happening in the body. We don't forget about malaria. Even though she's delivered, she still could get malaria. So malaria is number one. Then we have big problems about the breast. You know, during the pregnancy, the breast produces milk to feed the baby. Unfortunately for some of them, the baby is not able to suck the breast, and therefore the breast becomes engorged. Breast engorgement. The baby is not able to suck well, therefore there's a crack on the nipple. So we have cracked nipples. And even sometimes we have what we call sore nipple, because the baby is just chewing the nipple instead of holding the areola where the milk is. And because it's not holding properly, in other words, poor attachment, the nipple becomes sore. And it's very, very painful for the mother. The breast is swollen, it's painful, and the baby is not able to breastfeed. It's a big problem. Sometimes it even goes to form an abscess. It's what we call breast abscess. In other words, there is pus collection in the breast, which will, so Pastor, you can imagine how terrible this would be.
Exactly.
A woman who has just delivered, anticipating that the baby will be feeding well, and then suddenly the breast is swollen, one of them, or sometimes even both. And the surgeon will have to now take this one to theater to cut open the breast, to drain the pus. How does he feel the baby from now on? How does the woman feel? It's another big problem for them. Some of them also don't have enough milk. That's what they call not enough breast milk. They are very happy to breastfeed the baby, but there's no milk. It's another big problem for the woman. They have to be worried about all these things. And so when we start talking about why they get into problems, I think we understand better why these things are happening.
Yes, exactly, Doc.
You also have to think about a woman who has delivered, but was delivered through cesarean section. She could not deliver vaginally for several reasons. A lot of indications why she couldn't. She had to undergo a cesarean section. Unfortunately for this woman, the wound is not healing well. It gets infected. And we have to open the wound, put in instruments, and dress the wound. Cause a lot of pain for the woman. She can't breastfeed the baby very well. It's a big problem. Some of them will get what we call episiotomy. In other words, when the fetal head was down there, the outlet was so tight that the head could not come. And therefore, the midwife will have to make a cut to widen the outlet so that the head can come. After this episiotomy, the midwife has to suture it. The midwife or a doctor has to suture the cut. You have to give them anesthesia, local anesthesia. In fact, in some places, they even suture it just without giving anything. It's very painful. So the woman is undergoing, yes, very, very painful. Unfortunately for some of them, after this switching and all that, the wound gapes, opens up again. And they come to you in the consulting room, they are very worried. They can't walk well because of the pain. What is the problem? There was a cut. The cut is open. Yeah, they have to go through all this. Some of them will get infection in the uterus itself, what we call puerperal sepsis. So soon after delivery, for the next few weeks or so, the woman comes, the uterus is still up in the abdomen. After delivery, within 2 weeks, the womb should go out of the abdomen. You can't feel it. You shouldn't feel it. But for this unfortunate woman, the womb or the uterus is still palpable in the abdomen. We call it sub-involution. So even though it's 3 weeks now, the uterus should have gone outside the womb. It should be in the pelvis. It's still in the abdomen. And when you touch it, there's pain. So there's tenderness. The woman is getting vaginal discharge, very offensive. The temperature is high. And we call this one puerperal sepsis. There is infection. This time is not in the wound itself, the cut or the episode, but inside the uterus. It's another big problem. You have to put them on antibiotics and keep them. So instead of them going home earlier, now they have to stay for another week or so, just for the problem to be managed properly. So another problem that they face, puerperal sepsis. Then again, we have what we call urinary tract infection, UTI, urinary tract infection. It can also cause the temperature. Why is this happening? When the head is down there, it's pressing on the bladder, they cannot urinate properly, so the urine stays in there. The midwife will have to sometimes pass a catheter. It's a rubber tubing, pass through the urethra to the bladder so that the urine can be empty. We have to do it under aseptic conditions, sterile conditions. Unfortunately, sometimes for pressure of work and for inadequate resources, you have to just pass the catheter like that and causes infection. Sometimes you have to pass it 2 or 3 times. Other times, because they are going to theater, the catheter will have to stay in so that when the surgeon opens the abdomen, it doesn't damage the bladder. So the catheter will be put in before they go to theater. After theater, it will have to stay until the following day. So, Pastor, you can imagine this catheter inside there. It's a source of infection. And the woman can get infection. So this infection can climb up. So it's not in the bladder, can go through the ureters, even into the kidney. And they can get what we call pyelonephritis. So it's a whole big problem. From the urethra, through the bladder, to the ureters, and to the kidneys. Can be a problem. So the woman will come, temperature is very high, she's in pain. When you touch the flanks, she can't allow you to touch because it's very tender. So this UTI is all there.
Doc,
Also there. Most of the time, when they so you have to puncture. Yes, you have to puncture the vein on the arm. It's called venipuncture. You put a cannula there, take the needle out, and leave the cannula in so that the infusion can run. Medications can also run through there. If you don't put them under sterile conditions, and you just do it haphazardly because of pressure of work, you can get inflammation of the vein where you put the cannula. And this is called phlebitis. That can also cause temperature. Sometimes after the cesarean section or when they lie too long in bed, the veins that the blood will flow through because of the pressure on the bed, blood will stay instead of blood flowing properly. So you get blood stasis. If you are not lucky, you get what we call a clot forming. And later on, this blood clot can push up, especially when they start to walk. It can get lodged in the heart or even in the brain. And they can die suddenly. This is what we call embolism.
Okay.
So the vein there will be inflamed, phlebitis. Now you can get this thromboembolism as well. So, Pastor, a whole lot of issues happen. When the baby is out, you think everything is okay. No, everything is not okay yet. Unless you follow the procedures properly. So the woman can go through all these things. Sometimes when they are giving anesthesia for cesarean section, spinal doesn't work for some of them. We use spinal for almost everybody. But for some of them, the spinal fails. And you have to give intubation, general anesthesia. So they'll put the woman to sleep completely.
Okay.
And before they do that, they have to pass a tube through the throat, the trachea, so that oxygen will be flowing, so that even though she's asleep, she can be breathing well. So you can get inflammation in the throat, the trachea, tracheitis. You can get inflammation of the tonsils, tonsillitis. So the woman will come swelling of the neck, pain in the neck because of tonsillitis or tracheitis.
Okay.
Some of them will lie down for a long time in one position, so you can get atelectasis.
Sorry.
One area of the lung is not opening up well. So, Pastor, a whole lot of problems. So the woman will come to you with the temperature. The diagnosis is puerperal pyrexia. But where is it coming from? Is it from malaria? Is it from the respiratory tract infection, chest infection? Is it from the breast, from a mastitis or an abscess? Is it from urinary tract infection? Is it phlebitis from the vein? Is it an infected wound? Is it puerperal sepsis from the uterus itself? And you have to go from head to tract, not forgetting about puerperal or postpartum disorders that we face. Ideally, like what happens in the developed countries, you deliver this by most of these people. So no wonder as we go along, we talk about problems that the woman will go through. They have the blues, the depression, and the psychosis. I'm sure we'll come there later.
We'll get there.
Pastor, these are some of the things. Yes, we'll get there. So PPH, as I said, if you are not lucky, the woman can die.
Yeah, because of the blood.
So, yes, because she's bleeding to death.
Yeah, exactly.
And you know, the uterus receives so much blood that if there's a problem with the uterus, within a matter of minutes, the woman will start yawning and she'll be losing. It's like a burst pipe. Blood is just pouring out. If you are not fast, she starts yawning, throwing the arms around, the drip will go off, and you have to reset the drip. Meanwhile, the veins are collapsed. She's in shock. If you are not lucky, the woman can pass. So you have to do this. Sometimes, after all attempts to try and stop the bleeding, we don't succeed. So the last option is to take the uterus out. Pastor, this is something we don't want to know, to hear about, but it does happen. Nobody wants to, because assuming this young girl, 22-year-old, 24-year-old, this is the first pregnancy, probably even lost the baby as a stillbirth. She's bleeding to death. And now you have to take the uterus out. When the woman recovers and you tell her that the uterus is out, this will help you to understand when we get to the psychosis and the depression and all those things. She knows the whole world is ended for her.
Okay.
Because it means she can never have menses again. She won't get a child again. The only one that she had is also probably dead from asphyxia or even a stillbirth. Don't talk about the blood transfusion aspects. Sometimes we give some as many as 4 or 5 units of blood for them to survive. Look at where all this blood is coming from. Pastor Abidiaba has given one, Dr. Kojo has given one, this pastor has given one, this doctor has given one. You know where the sources, where they are coming from. Yes, we can test the blood, all right. But you can't test for all the items that you are supposed to test for. So probably there's a hidden infection.
Exactly.
Supposing somebody is HIV, is in the window period. You tested, she's negative, or the person is
yeah.
negative. Oh, fine, that is fine. But because she was in the window period, that was why it was negative. So 6 weeks later, now the thing has flared up. And the woman is going to get HIV or get another infection. So, Pastor, it's not easy. The amount of blood you have to transfuse, the uterus going out, a whole lot of problems for this woman. So, as I said the other time, when the woman goes through this life and death and comes out, we have to be all very happy and thank God. It's not an easy thing. In your intro, you said it, they've gone through the life and death and they've come. It's not an easy issue. And if people remember, I think the last time, I don't know what I mentioned, that there's a term we call DIC. DIC.
And I'll talk about it. Probably talk about it.
The medical terminology, DIC stands for disseminated intravascular coagulation. In other words, the body has used up all the coagulating factors because of a problem during the pregnancy. And now she starts bleeding and the blood cannot flow. She's going to die. And that is why doctors have christened this DIC, for the layman to understand, as death is coming. Death is coming. Because, Pastor, when you face this one, 10 people facing it, about 8 of them will pass.
Exactly.
In our area, because outside they have the platelets, they have the fresh frozen plasma, they have everything. But here, sometimes even just getting 1 pint of blood, 1 unit,
it's difficult.
You have to make announcement at church.
Yeah, it's difficult.
You can come and donate, and before you get, and this is the time that you need it there and then.
Yeah.
Not tomorrow bring it. No. We need it there and then. So, in our environment here, you are not lucky and you get it, you are in a big problem. A lot of them will pass. But luckily these days, because of the problem we are facing, most hospitals are making sure that they get enough blood. But sometimes, I'm happy that Adventist youth, when they have their meetings, they're able to donate. Exactly. And a lot of them, they have good blood.
Yeah.
So when we have enough blood, they can do the platelet concentrate, fresh frozen plasma, they will be available. So when we have that one, DIC will come and the woman will survive. But where you don't have this available, this is not a time for you to wait for somebody like in Sunyani to go to Techman to go and bring. No. It'll be too late. It'll be too late. So the women have a whole lot of issues. So that's number one. BPH is a big problem. But luckily, we are overcoming it gradually.
We thank God.
What we call DIC. If a woman is pregnant and has a problem and the woman dies, the fetus dies in utero, in other words, inside the utero, inside there, and we don't get the fetus out quickly, it stays in and starts using up the clotting factors. So for any intrauterine death, IUD, the moment we detect quickly, we have to make sure that we get the dead fetus out. Whatever means possible. Usually we fetus come, but sometimes it doesn't work. It fails. We do catheter induction, it doesn't work. You have the only option left to go and cut and remove a dead baby, which is another sad thing. A baby or fetus is dead inside there. You try all maneuvers, it's not coming. Unfortunately, you have to go and cut the woman to bring the dead fetus. That's a very sad thing. But sometimes that's up because the woman is worried, the husband is worried. Doctor, I know we also assume that for 3 days a mile. The doctors are worried. So we have to get it up. If you delay too long, this DIC can set. If the placenta separates, I think that during the antenatal time or the prenatal, I think we mentioned it, antepartum hemorrhage.
Exactly.
Where the placenta has separated prematurely.
Exactly. Yeah.
And the blood is not coming out for the midwife to detect or for the doctor to know. And the doctor doesn't have a lot of experience so that this abdomen is too hard. Fetal heart is not there. Most likely it's a abrupt shoot. And they say, oh, it's a dead fetus. Okay, let's go and put misoprostol there and wait for tomorrow. No, it's too late. So you have to pick it quickly. Otherwise, all the blood is collecting inside the womb, behind the placenta. And it's clotting there. So if you delay too long and it gets inside there, you take the fetus out and she starts bleeding. Pop, pop, pop. No clotting, non-stop. DIC are setting. So, Pastor, we have to know all this and then help the woman.
Thank you.
So that we act fast. So the doctors will have to act fast. Midwives will have to do their part. Blood will have to be ready. So that this woman doesn't have to go through. So BPH is a big problem. And then again, let me come to the loss of the baby as I said earlier on. Why would the baby die? We have a whole lot of costs. The first one is the baby has stayed in the womb for too long, more than necessary. I think during the antenatal or the prenatal time, I mentioned that they are supposed to stay there for 40 weeks with a grace period of 2 weeks, so maximum 42 weeks. But for some reason, this woman stays in the village and is not able to come to the antenatal regularly. She comes and it's already 44 weeks. The placenta has finished its function. It's not providing anything for the fetus. So the fetus is dead. And it's been dead for another 2 weeks. Big problem. IUD. This can also go to DIC. So post dates, more than 42 weeks, and you haven't taken any action, the fetus will die. Because it has overstayed. All that it needs to survive has been used up. So it will die. The other one is a long umbilical cord.
Okay.
As the fetus is in the womb, floating in the fluid, the amniotic fluid, it is tossing, doing this somersaulting and all that, dancing here and there. So the cord can go around the neck and even sometimes the thighs. When it goes just around the neck and the fetus continues to move around, it becomes tighter. So it will hold the neck like somebody who's causing suicide. So the baby comes out and is dead. It does happen, we see it. There's another one called true knot. This time it didn't go around the neck, but because the fetus is maneuvering its way around, there is a knot in the cord. When it becomes very tight, blood flow doesn't go through again. So the fetus doesn't get blood, doesn't get any oxygen, doesn't get any feeding. Fetus will die. We talked about abortion already. The woman goes somewhere, falls up, then hits the abdomen, either on the farm, on the market, or somewhere, on a bad road, as you get on most of our roads in Ghana. The placenta are separated. Once the placenta separates, the fetus will die. So the woman will come in with a dead. We have other medical conditions like HIV. If a woman has HIV and is not on treatment, the fetus can die. Malaria. If you don't treat it promptly, the fetus can die in you. There's another condition that we call rhesus incompatibility. Rhesus. You know, for every blood group, we have A, B, and O.
Oh, yeah.
We also have the rhesus. That's what we call the positive. So we have A positive, A negative. B positive, B negative. AB positive, AB negative. And then we have O negative. A. We have all this, the four types. If the husband is positive, let's say A positive, and the wife is either A or O, but it's negative, that's where the problem comes. Pastor, for the first baby, there's no problem. First pregnancy, no problem. Because the fetus has not gotten the chance to leave any bad effect in the woman's life. But once it's born, and it's not taking the mother's negative, but rather take the father's positive. He has left a very bad charge in the woman. So for the subsequent pregnancies, maybe the woman didn't know, it didn't go months later. The doctors didn't check. Now they check it every end later. Blood group. If they find that you are negative, you have to give you bad effects that had been left. So that the subsequent pregnancies, you don't have any problem. But there are cases where this thing is not done. Because of where they are coming from, non-availability of. So they delivered the first one, everything was fine. She thinks everything is fine. Second pregnancy is now going up almost 38 weeks, just about to deliver. But the woman, the baby has now developed anemia in utero. It's not bleeding, but the blood has been destroyed, so it doesn't have blood. Elsewhere, in the developed world, they can detect the anemia, they can transfuse the fetus in utero. They can transfuse the utero while it's inside. Here we can't do that. In the first place, they didn't know anyway. So the fetus dies. It dies in utero. So rhesus incompatibility is also. Because a whole lot of problems can let the fetus die in utero.
Yes, doctor, a whole lot of issues.
That
is true. A whole lot of issues. Viewers, we are into the postpartum disorders. Doctor is taking his time to educate us on things that may attribute or contribute to the pains after a woman has given birth. And he said motherhood can feel so isolating and lonely. Motherhood can feel like you are the only one going through what you are going through. Motherhood can make you feel like no one else feels the way you do. But mama, you are not alone. Every mother on this platform, every mother watching us, we want to tell you that you are not alone. It's because of you that we have brought Dr. Fojo to educate us on a lot of things that we go through after birth. And husbands, we know that when it gets to the supporting part, husband, you also be educated as to what to do to help your woman after birth come back to normal, so that at least the whole family would enjoy. Please, in case you just joined us, we are talking about postpartum disorders, and we are live on Hope TV GH Facebook and YouTube page. Please, you can still share and share, subscribe and share to other platforms, so that this education wouldn't go wasted. But then people from far and near would understand and help themselves out. Please, I'll be going for this break. When I return, doctor comes in with the types of postpartum disorders and the causes and how best we'll be able to deal with it. So please don't go anywhere. I will be right back. Hello there. Welcome back from the break. We are discussing postpartum disorders, and with me is Dr. Fojo. You know him, worked with Sunyani Regional Hospital for more than 40 years, and he's currently with the Adventist Hospital in Sunyani. He's one of the best gynaecists that I've ever heard of. So whatever education he's giving us, please let's take it seriously, and let's see how best we're going to help us and help our mother, our wife, our auntie, our sister who is about delivering, so that at least we can help them out. Doctor, so Doc, what are the types of postpartum disorders? Do we have any types? Hello, Doc.
Yes, we do.
So please, what are some of the types? Yes.
Yeah, the types. Yeah.
Exactly.
I think I've just gone through the physical ones.
Exactly.
But now we have what we call the postpartum blues. Postpartum blues. Or peripartum blues. And then we have postpartum depression.
Okay.
And then the most severe form is what we call the postpartum psychosis or peripartum psychosis.
Postpartum
so we have the
blues,
the depression, and the psychosis.
So that briefly take your time and take us through a bit what the blues means, what the depression and the psychosis, so that at least we'll see what the Lord will have for us. Yes, Edda.
Yeah, thank you very much, Pastor. And soon after delivery, you know, the stress that the woman has gone through, the sudden change that has taken place in the hormone. And the fact that the woman now has to think about taking care of a new baby. You know, they feel a bit unhappy. Sometimes they can even be weepy. They feel moody.
Mm-hmm.
It tends to be normal with a lot of from the state. Formerly you were alone. Now you have a baby to take care of. You have to think about breastfeeding, think about work, think about all a bit uncomfortable. And that is what we call the blues. Within a short time, it goes away. That is not so severe or serious. Then we have the depression. I think we'll be going through this into details. The depression. The woman is very worried. She's not talking to anybody. She's not eating.
Mm.
And the last one is the psychosis, where they can even become aggressive. They can harm themselves, they can harm their mother or the baby or the nurse or the doctor. They will get hallucinations, visual hallucinations, auditory hallucinations. They can't sleep. And that one is very serious. It's an emergency, it needs to be attended to. So after going through the physical one that we just mentioned, the PPH that we talked about, loss of the baby, puerperal pyrexia, malaria, urinary tract infection, chest, and all those things. We have to contend with these three others as well. The postpartum blues, PPB, postpartum depression, PPD, and postpartum psychosis, PPP. This one is not pre-papa prep. No. This one is PPP.
Postpartum psychosis.
Postpartum or prepartum psychosis. It's a very, very big list. Yeah.
All right. So Doc,
maybe.
No, finish. Please finish first, then.
Yeah. I just wanted to know whether we are going to go through now or but I wanted to talk about the puerperal sepsis.
Doc, no problem. Talk about it because we have about 15 minutes to end this session. So talk about it so that we can push it to the next part 2 of it. So talk about it.
Okay, then maybe when we are through with this and the next time we'll go through the 3 types proper.
Exactly.
Yeah, I talked about postpartum hemorrhage. I talked a lot about DIC and all those things, transfusions, and now let's talk about puerperal sepsis. As for the breast, I think I said a lot already.
Exactly.
It's the major thing that the woman has to contend with, because that is where the baby is going to feed. So if you have cracked nipple, sore nipple, or swelling, engorgement, mastitis, you are in trouble. You'll be having your temperature, you're having pain, the baby is not able to breastfeed, and sometimes you have to even drain it. But now let me come to the puerperal sepsis. Why do we get puerperal sepsis most of the time? Number one, infection has gone all the way into the uterus. During delivery, Pastor, especially those that happen at home before they come, people have inserted some people even insert certain herbs to facilitate delivery before they are brought to us. Yes, there are certain herbs that they give and then it can cause uterine contraction, very strong ones. So the woman will tell you that I went for this enema so that I can deliver fast. And sometimes the uterus can even rupture because the baby was in transit and contractions were strong. So, Pastor, when you keep inserting these things there, infection will definitely go up. Most of them, when we discharge them, because they delivered on their own and they went home the following day, for SVDs, continuous vaginal delivery, everything is fine. Following day, you go home. You go home. They go home and they start inserting certain things, some rags and other things. Or some people will put cotton wool there to stop the blood that's coming and they leave it there. When you get this infection, it will climb up. Some of them will get episiotomy, as I said earlier on. There's a cut. The nurse or midwife will suture it nicely for you. They go home and they start sitting on hot water. Because your mommy will tell you that you grew and to heal it, you need hot water to sit on the hot water or sit in the hot water so that the crew will heal. So then I keep asking myself, what happens to our Caucasians, the whites? Do they also go and sit on hot water? But they don't get the infection. But they get well. But here, they'll tell you, bro, for you to heal, you have to do this. Take NMS, take this one. So the suturing that was done there, first, the sutures will dissolve on the but now because of the hot water, within 2 days, the sutures are out. So definitely the wound will give. That's why most of them will come with the gift. Or because of the kind of thing that they apply to the vulva and the vagina, infection will climb up. So the woman will come with the uterus still in the abdomen, tender, very painful, with a discharge coming from the vagina. Majority of them is because of the way we handle the post-delivery period. So we have to be very, very, very careful. If you get a cesarean section and they put a plaster on it, they say don't go and wet it. Some people will go and bath and wet it. And they will not remove the plaster for a fresh one. So they will leave the gauze and the plaster on, wet. Because the wound will definitely get infected. You will be surprised to hear that even some of them who apply certain herbs, they will grind some herbs and apply it to the wound. They think it will make it heal faster or the wound will be nicer. They come and the wound is infected. And this will all spread and cause puerperal pyrexia, temperature will be up. But I'm very particular about the puerperal cell. Because when you get that one, it starts from the vagina or the vulva. Let's put it there if there's an episode or the perineum. It will go through the vagina, through the cervix because it's still open for the blood that is there to drain out. And it will go inside the womb, the uterus, and it will climb up. We call it ascending infection. It's climbing up, descending. It will go through the fallopian tubes. The fallopian tubes are the ones that carry the egg for the sperm to meet it for pregnancy. So if you're not careful and you get this infection and it's not properly treated, by the time you are out of the period, the postpartum period, your fallopian tubes are blocked fast. Next pregnancy will be a big problem. You may have to go for an IVF or something. So you can imagine the kind of problem the woman goes through. So they have to follow the midwife's instruction or the doctor's instruction. Don't apply anything to the wound. When you come and we remove the dressing and we find out it's dry, we ask you to use just spirit. When you bath, wash it clean, apply spirit. Don't apply any herbs or any concoction. The same way, don't apply any herbs or concoction inside the vagina with the hope that we are healing it. But no, you cause problem. So once you follow these things, you'll be fine. You will not get this puerperal sepsis to this offensive vaginal discharge. Uterus is not contracting, it's still up there. Sometimes we have to readmit them and start them on parenteral antibiotics. Where parenteral means we have to give an injection in the vein. Not even through the bottle, through the vein, parenteral. Because the infection is very severe. To be a UTI or this sarcopenitis because the fallopian tubes are involved, or endometritis, the inside of the womb is involved. So, Pastor, when we follow these instructions from our midwife and the doctors, and we don't listen to the home, in quotes, home doctors, especially the grandmothers, you get better, and you make sure they do it. And these are the same grandmothers who, when they are bathing the baby, you put water in the mouth. The baby should drink water because if it's a male, they will leave the penis and pour water into the penis so that the penis will be full. After they do all this, so the woman will come with the baby, the umbilical stamp is infected, umbilitis, the umbilical stamp. And if that one is infected, it goes straight into the liver because there's a connection to the baby's liver. The baby will be jaundice and a whole lot of things. So please, when you come and deliver at our place, the midwife will give you instructions. Please follow them. so that you avoid these postpartum disorders. One of which is very severe, and I'm talking of puerperal sepsis. And for the breast, I think I've talked about it.
Exactly.
Yes.
Right.
And the PPH, that one we deal with it even before.
Exactly.
So let's do this and let's take our babies home healthy, mother healthy, husband will be happy. And when these things go on, Pastor, even after 40 days, just 40 days, when the woman is fresh, after attending the welfare clinic, you want to start the game again, you are allowed to. If it's not cesarean section. Yes, but when you start getting all these complications, that's when you have to go there 3 months and or 6 months before you go. So, the postpartum period, there are loads of issues. I think we've spoken about some of them.
Exactly.
But two major ones, PPH and the breast. And now talk about the puerperal sex. Okay. Anything dealing with the vagina, the cervix, is going straight into the abdominal. Pastor, one interesting thing I mentioned before I go out. For a woman, you can start from the vagina, cervix, uterus, and go into the abdomen. There's a communication.
Okay.
You don't have this for men. For a man, if you go to the urethra, where we pass the urine, and you go to a blunt or a blind end, you can't enter the abdomen. For the woman, because of the fallopian tubes, which are open at the femoral head, infection can go through and enter the abdomen. So you don't only get the puerperal infection, you get peritonitis. You are now in the peritoneum, in the abdominal cavity, which is very severe. But sometimes it's so bad that the surgeon will have to come. This I'm not the gynecologist. Most of the time we can handle that one, but sometimes it's so bad that it has affected other things. It has affected your appendix, your intestines, and we need to call the surgeon. So please, follow the midwife's instructions. Get good health for yourself, for your baby, and let everybody be happy. It will do us a lot of good. So we all need to play our part. Our grandmothers, our mothers, they need to play their part. We have to educate the husband, we have to educate them. Some husbands, Pastor, they are also too aggressive. Some husbands, we had one who were very, very worried. Within 2 weeks, he wanted to go inside. Why? So I can't do it like sleep for the
Operator, look, operator, watch it.
So, husbands, parents, friends, everybody has a part to make the woman healthy during the postpartum period, so that they don't get all these problems. Thank you.
But Doc, we have 5 minutes to wrap up this episode. But you made mention of the grandparents doing a lot of. You mentioned grandparents doing a lot of what we call local home midwifery thing. But Doc, somebody would say that what they do had really helped them in a way, helped their children in a way. Medically, what do you have to say about that?
Yeah, thank you very much, Pastor. Grandmas are doing so many things to their grandchildren and even to the woman who has just delivered. And we have noticed that most of them are not very helpful at all.
Okay.
Pastor, they will argue that in times past, in the olden days, they used to do them. But that was when they could deliver 10 and 4 of them will die, leaving 6. These days, women are delivering 2, 3. They cannot afford to let 1 or 2 go. A whole lot of some of those practices are not helpful, to be honest with you. And we have to point it out to them for them to know, because those days, they could apply certain things to the umbilical stamp, and the children were getting neonatal tetanus, and they were dying. Cow dung died to the umbilical stamp, and babies were getting neonatal. We cannot do that. They still insist that they want to give our newborn babies water to drink because the baby is hot weather and they need water. Meanwhile, the breast milk contains 80% water.
Okay.
So if you add water, the small amount that the baby is able to take, it's not able to get the nutrients that they need. we have to put it in their minds. Let them know that, no, the breast milk is adequate. That's how God prepared it. It has water for them. It has the nutrients, the proteins, and take the baby from so many illnesses. So please, they should follow the current instructions.
Thank you. Thank you.
Yes. I myself, I know when I was young, when you go to the bush, you get a cut, you just apply some herbs with the dirt. You just apply it to the wound. We are not getting tetanus, but now you can't attempt it. Pastor.
Exactly.
My sister went and delivered on the farm, delivered on her own, no assistance. She used the cutlass to cut the umbilical stump, tied it with a rope in the farm, and brought the baby home. Nothing happened. But nowadays, even on the labor ward,
people are dying.
Pastor, on the labor ward, if you joke, you'll be in trouble. You'll be in trouble. Because if you don't cut it well and tie it well and he starts bleeding,
exactly.
Trouble for you. So things have changed, Pastor.
Yeah, exactly, Doc. Exactly, Doc.
And if I should go maybe back a bit.
Doc, we'll put it in the next session. Don't worry. We'll put it in the next session.
For us.
We'll put it in the next session, Doctor. You don't have a problem. You will put it in the next session. So that at least I'll ask and you take your time to answer these questions. And viewers, time is not on our side. Doctor have just started with us on the postpartum disorders. He has said a lot. And in case you missed it, you can still go back to our YouTube page or Facebook page or Hope TVGH, and you have the feel to watch those the education that he gave. A lot of things have changed. So let us also be abreast with time, because at the end of the day, things that we used to do last 10 years can't be done this year or this moment we are in. So please, the education that he's getting with us, let us hump on it and let us do our best to grasp it. In part 2, we're going to discuss the effect, the blues, the depression, and the psychosis. All of them, the effect that is associated with the types of disorders when it comes to postpartum. I'm not sure you're going to miss it. And as we have enjoyed the part 1 introducing it to us, the part 2 will be massive. Please, I want you to tell a friend for a friend to tell a friend, especially our wives, our mothers, our aunties who are about to deliver, so that at least they will learn a bit of it and it will do them good. And if you are watching me, you have gone through this experience before, whether prenatal issues or postpartum issues, you can call my line or 0559 535 554, 0559 535 554, or you send WhatsApp to 0559 680066 and just tell us that you want to share your experience. And that day will bring, it may be however you're going to do it. And when you share the experience, doctor will let us know that whether it fell under the blues or under the depression or under the psychosis. And at least people would also have the chance to be educated themselves. Doctor, God bless you for your time. That's Dr. Fodio. Doctor, God bless you for your time. I know next week for the part 2, you'll be on standby to also share the rest of the experiences that you have for us. I wouldn't let you say anything because I'll have you in part 2. So Dr. Fodio, God bless you. And we're going to meet next week for the part 2. Viewers, God bless you for watching this episode. And I know your ears are itching for the part 2. And we're going to do a beautiful work with Doctor for the part 2. Please, please, please. I have been your regular host, and the name is Pastor Dan Abedu Bidiaba. I am out.